Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber, and I want to welcome you to this week's Limited Healthcare and Personal Service Office Hours. We will be making some changes to these sessions in the coming weeks. The personal services and limited healthcare will continue to be on Tuesdays at 3 o'clock, but we will be adding retail along with that. So we want to continue to have these opportunities for you to hear the updated information, and as we know, there will be some updates specifically in some of these industries. Ask your questions and provide feedback. It's very important that as an economy, our businesses continue to follow the health standards and requirements. We want to build confidence in our patrons. We want to build confidence in our customers, and we want to build customer confidence in our employees so that we can get both our economy up and running, but we can also keep people safe and healthy. At this time, I'm going to hand it over to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. So I just want to get started by going over the agenda and purpose of today's meeting. And I think the biggest thing is that we're going to try and get to the Q&A section of this quickly so that we can address any questions and concerns you all might have. But we're going to start with a little bit about a little bit of background and some of the resources that we have to support you in opening up and continuing to operate. And then we're going to go into a little bit of the detail about what's currently allowed under Safer at Home and then the proposed changes that are coming. So the timeline, I just tried to advance my own slides here. The timeline is the same as you've seen this before in our presentations, but I think the big thing is that, on June 1st, the Safer at Home order was extended through the 30th, but some changes were made on that date in terms of short-term rentals. And then on the 3rd, they're expecting, which is tomorrow, they'll be expecting feedback on houses of worship, outdoor recreation, personal recreation, and changes to personal services. And then tomorrow, many of those changes will go into effect, and that's what we're going to be talking about today. So again, the long-term outlook, this has been the same slide for a while as well. Safer at Home will evolve. It's not going to go away at the end of June. And the markers we're looking for to see that new normal arrive is really treatment, vaccine, and eventual herd immunity. And just a little bit, just to remind everyone, COVID-19 is still just as contagious as it was last month and the month before and before that. So the Safer at Home order still encourages people to stay at home as much as possible. And the face covering rules, the Boulder County face covering ordinance is still in place. And I think it's important, Cammie and I have talked about this in previous presentations, particularly with respect to personal services and limited healthcare. The strictest order or the strictest guidance applies to your industries. In a lot of cases, there are caveats in the local order but there are stricter guidance in the state order. And so you'll need to continue to use face coverings, as will your patients, customers. The state order compliance is obligatory. The order from the governor has to be followed. It is the law. The requirements do change regularly, and we are, through our website, trying to keep up with those changes. That's a great way for you to follow those changes, but also the state website. And we'll get into those resources in a moment. But I also wanted to just check in with everyone and remind you that while we are working to support you, while the state is working to support you, if you have specific questions about how your practices are adhering to the obligatory orders from the state, it is best to contact an attorney. They can get into the very specific levels of your compliance. And a little bit about outbreaks. As we are heading into this more open phase, if 2 or more of your employees are confirmed or suspected of having COVID-19 within a 14-day period, that's considered an outbreak. And what you need to do is fill out the form that's available on our website and linked to here. And then our epidemiological team will reach out, and you'll also get contacted by the business liaison team as that continues, so we can ensure that you have the tools you need to help your employees and protect your business.
And can I just add one thing here, Jesse? I just want to say that just because you might have an outbreak or potential outbreak doesn't mean your business will automatically close. I know there's a lot of businesses that are fearful of that, of like, we just opened up, I'm afraid. So please don't avoid reporting it. It's the way to keep, you know, your staff and your clients healthy. It is not an automatic closure just because there's an outbreak. And that's where each case is kind of tailored through that work with our local epidemiologists about what's the right plan for your business based on the severity and reach of the potential outbreak.
Thanks for that, Cami. That's absolutely true. And so thanks for mentioning that.
Yeah.
So just a couple spotlights for resources. We have up on our website summer programs, including camps, guidance on how to operate those. There's the draft guidance that's come out. And then we've recently updated the space calculator. It's incredibly robust now. It's pretty impressive. It's broken down by industry. The face covering script has been updated. There are past webinar videos available on the Chamber website. And then we've been updating the sector checklists as we go along, because there's now a new order that just came out and will go into effect tomorrow. We'll be, again, updating those sector checklists as we get the latest, for sure, changes to the order.
Yeah, and in case anyone's interested, I know the restaurants and food services is currently either already updated or being updated, as well as a manufacturing one. For us folks, the personal services, it's temporary unavailable until we can get the full guidance tomorrow, and then we'll make sure all those changes are accounted for. And then we will definitely go over all the change details in next week's webinar.
Yep. Yep.
And Jesse, do you know, is the restaurant checklist up, or are they working on it?
As far as
they're working on it still.
Okay. It's not.
Corinne is shaking her head. Yeah. Okay. So a couple you may, if you're used to looking there, they may not be there temporarily. Oops, did he freeze up? Looks like Jesse may have frozen up a little.
Right.
Oh, he's back. I'll just go for a second here. Here is what the list on our web page looks like. There is our web page that you can get to these resources. But just wanted to point out.
I think I'm back.
Oh, good. Okay. I was just pointing out the PPE guidance resource, which is sort of about 5th down on this list, has been one that a number of you have been asking about on top of the Energize Colorado website. This PDF that we have has a number of different places where you can source different needed materials. So it's not just the Energize Colorado website, but all the updates that Jesse was talking about, they're here on this list, as well as the list on the right side that has to do with all the different checklists we have, which combine all of the requirements and recommendations for all the different business sectors. Looks like we may have lost Jesse, so I'll just keep on going. Some of the websites, like we said, is ours, Boulder County Public Health. We've compiled a bunch of the most commonly used or needed or questioned resources from the state and us onto our site. Here's the Colorado site. If you haven't been to it yet, definitely recommend you go to it and click on the Safer at Home tab. It will have all the sectors, business sectors information. Energize Colorado, as we just mentioned, this is an online marketplace for some PPE, but not necessarily everything you might be looking for, as well as just a reminder to review your chamber, your local chamber sites, your business development sites, your industry associations, your licensing agencies, cities and towns. They all are collecting information to try to support you as well. So here's kind of the meat we're going to get into today, is that there has been new guidance drafted by the state. that they plan to update tomorrow. So you can currently, and I think Corinne, you will send out all the draft documents with the links for them to provide feedback. And I know we've linked to it here as well. But it's open comment for all the public right now in Colorado. That is open until tomorrow at noon. And the areas that they're asking for comments on are focused on outdoor recreation, personal recreation, and then some updates to personal services. And most of it, we're going to go over what those look like here next. But not a whole lot changes for kind of this general group of personal services, but a few areas have a lot more guidance than they've ever had before. So we're just encouraging, please, please, please give that feedback, because after noon tomorrow, they won't be accepting that feedback. But here is one of the changes that applies to probably everybody on this webinar right now. Is for a while now, you've been limited to no more than 10 people in a facility at one time, and or at 50% of your capacity, whichever is less. As of Thursday, June 4th, they've already have this published on the website. This is one of, I guess, the changes they're making. It's not necessarily open, I guess, for feedback. They're just sort of doing it, is that there'll be no more than 50 people in a facility at one time, or at the maximum of 50% occupancy, whichever is less. So that is going to be good news for, I'm sure, a number of you. And another area that is really getting a lot more guidance than they ever have before is for the places of worship. That the safest option that they're currently recommending into the proposed guidelines is to continue doing online services, if that's something you're able to do or would like to do. They now have new drafted requirements in these areas around physical and social distancing, cleaning practices, masks, and inside and outside limit capacities. And in general, they're saying obviously groups, household groups that are living together can obviously be closer than 6 feet, but then outside of that, everyone needs to be spaced 6 feet apart. And then they have a lot of other strongly recommended guidelines or other areas of recommendation that is also in this drafted guidance, which has to do with this bullet point list here. So instead of going through every single detail that is in the draft guidelines, I'm just really going to encourage you all, if this area of personal services is of interest to you, please review that tonight and provide your feedback by noon tomorrow, as these will go live, these new recommendations, as of Thursday at some time when the governor releases it. But they have a lot of really good ideas. I will say one of the things that I think is improving upon is the drafted guidelines for this area are a better draft than often other sectors have come out with. They're getting better at providing robust guidelines when they sort of open a new sector. So you are benefiting, I think, from the lessons learned of some other sectors that didn't have enough information up front. The fact that they have all these bulleted lists here on the right side of your screen shows that they're thinking through a lot of the details. So, and I'm sure that's coming from a lot of you giving feedback already to the state. I guess Jesse, yeah.
Yeah. I get the easy part of today's guidance. There are no changes to the limited healthcare guidance in the 5th order. So keep an eye out. I'm sure there will be someday, but you know, generally the types of work that's being done, we're still concerned about the possibility of transmission, and so keeping a pretty tight lid on, you know, things like mask wearing and cleaning processes.
And I'll just add that I believe there's going to be some minor changes, excuse me, to the overall guidance that everyone has to apply in their business. So it's not necessarily going to be limited healthcare specific or personal services specific, but again, those general guidelines might be loosening a little bit. So we will update you with all, if any of those general guidelines that everyone has to follow for operating a business as well next Tuesday. But I think there's a few potential changes within that batch of guidance as well. Just a reminder, we just are kind of really just, you know, focusing on that today, is please, please, please read the draft state guidance that we'll make available to you. Give your input as soon as possible. I was going to show you real quick, if I can change screens here, what the draft feedback form looks like. Just a second.
Tammy, you're gonna need to unshare and then share that screen since we didn't.
Okay. Oops. Let me get back to.
And while you're doing that, I was asked for the social distancing space calculator, which will go out in the email, but I put it in the chat if you're wondering about that calculator. And while, yep, and so that's in the chat and it will come out in email as well.
Oops. It didn't save what I was hoping for. Just a second. Sorry, folks. I accidentally closed it.
Jesse, you kind of look like a shadow in this. In your
Yeah,
newest
sorry.
picture.
I'm trying to figure out the best way to give you all.
Sorry, it's not, I can't get it pulled up. But what I'll say is that the, oh, let me reshare just a second. That the draft feedback form doesn't allow you to, can you see my screen yet?
We can see your PowerPoint.
Okay. Sorry, I couldn't get the form pulled back up. But the form itself is really just a check, or not a checkbox. Yeah, I guess like you get to pick one or pick all. It doesn't really have any open feedback boxes. So if you have sort of bulk information you'd like to provide, I provided the link at the bottom here, which is the general state comment form. If once you fill out this draft guidance specific worksheet that they filled out, if it doesn't really meet your needs, I still suggest on the bottom of any of the state's websites, you can click on this issues and concerns form and provide more information. I don't know if it will reach them in time before the draft guidance is completed, but just if you felt like you aren't getting your needs heard through the draft guidance feedback form, there's another form that you can try. So just wanted to put that out there.
And I had some people actually put together their feedback because they weren't able to actually even access the form. So they gave me their feedback and I submitted it on behalf of several businesses this morning.
Oh, thank you, Corinne. Okay.
Thank you.
So before we get into the Q&A, just to reiterate what Corinne said, on Tuesday afternoons are really going to become kind of our office hour webinar afternoons. We're combining a number of different specialties into webinars to kind of condense how many we're doing. So for you folks who are still interested in personal services or limited healthcare, starting next week, we're also going to have retail join us and we're going to present together. As we know, a lot of personal services and limited healthcare settings also are retail settings. So we're going to join forces there. For those of you who fall under personal services still, but are more aligned with sort of the exercise, physical fitness, personal training side of things, we are still holding a separate webinar for that at 4 o'clock on Tuesdays. So we're doing one of those kind of specific areas webinars right after this today at 4. And we're going to continue that because there's a lot of new information for that wing of the world for people. So we're going to go over a lot of draft guidance for that crew next. And then Wednesdays, we still have a Spanish speaking session. So please share that with anyone who prefer to get this information in Spanish. And then Thursdays, instead of having a bunch of individual sessions like Tuesdays, we're going to just do more of a general session one, which I think topics will kind of to be determined each week based on need and what pops up as far as industry changes. And so this is what we wanted to get to, is knowing that there's going to be a lot of updated guidance available come Thursday and that we will review all of it definitely next week on Tuesday. What else can we focus on today or review today that would be helpful to you listening? So I know, Corinne, you want them, maybe tell them which platform or which button to use.
Yep, so please use the Q&A or you can use the chat with this group as well. In addition, because I can manage this group a little bit, we have a little less on this call than previous weeks. If you'd want to raise your hand and you're not able to type something in and ask a question, I can make that happen as well. We do have one question. Someone used the space calculator and said they found that they can accommodate 13, but we're still restricted to 10 or less. Is that correct?
Yes, until the 4th. As of the 4th, that number might go up depending. So everyone's still limited to 10. So even if the space calculator says you can have 13, you're still limited to 10 right now by law. After Thursday, the limit will change to 50, but that doesn't mean you can hold 50 in your space safely, because it doesn't mean you'll be able to maintain the 6 feet social distance that's needed. So come Thursday, if that might be where you're able to go up to 13, 14, 15 and still safely meet all the other requirements. So it doesn't mean you go up to 50 just because you can. You still have to have 50% max capacity, and you still have to have the social distancing requirements met. It's just for those large facilities that would always be able to maybe hold hundreds and hundreds, have been limited to 10. They're going to be able to increase their facilities up to 50. But smaller spaces might not really get that many more people out of it, because they won't be able to maintain social distancing within those smaller spaces. So it might not change for some, but it might change for some, so others who are bigger spaces.
And the reason the space calculator is live is because it was used to assist retail up to this point, because retail, there's not human to human contact. You're not cutting hair. You're not doing some of the stuff that personal services, and that 6 feet was to be maintained at all times in retail, and that's what the space calculator was originally created for.
It may allow some of you to have more people in a building space that aren't providing the direct services, like some of the other support staff, whether it's office-based staff or retail-based staff who might not have been the direct service staff. You may be able to get more of those folks in the office if that's a helpful new grouping of people in a space, with being allowed to have a few more come into the office and not be limited to 10 max across the board.
Mm-hmm. Yeah, so yeah, we've heard that, to make sure that they can get as many customers in as possible, they've limited, the receptionist or the person who's greeting at the door and so forth.
And we still very much recommend the curbside option, because anytime you have people come into your business, especially for retail or some other maybe like combining of different sectors, that counts towards your total capacity. So if you are finding it hard to stay at your capacity limits while you're serving clients because you have a retail wing set up, you might want to have a staff or person too that is sort of controlled in your count, do curbside delivery, so you still don't have public coming in and messing up kind of those max limits on your behalf on the retail side of things, when you want to make sure you stay within the proper limits for the service side of things.
Okay. Great feedback, and some of the best practices that some businesses are doing in order to adapt, as I've said on several calls today. Do we expect any changes to the face mask requirements so that estheticians can perform facials, or dermatologists, in the limited healthcare area can
not
perform?
In this update. It may come in future updates, but definitely not in this update. Yes, masks are probably, I would assume, going to be one of the later items that get sort of adjusted or released, just because of the safety factor of droplets and breathing, and that's how the virus is transmitted. So unfortunately, I understand those group of folks are limited. I don't know that is going to change anytime soon, but it's not in this next update as of Thursday.
All right, so this question says, I work on a floor with 64 individual offices, so four walls and a door. Are we limited to 50 people on the floor at any given time?
It kind of depends, and Cammie, correct me if I'm wrong, but if it's 64 individual businesses, that's one thing. But if you're talking about, you have an individual business that just happens to have 64 individual offices, your business space is limited to that as of the 4th to 50 individuals, I guess, or 50% of the capacity.
Yeah, and I would say if the office is max capacity 64, the most you could have in there anyway would be 32 people.
Right.
So just like restaurants, it's 50 or 50% of your capacity, whichever's lower.
Whatever's less. Yep, whichever's lower.
Okay.
So really, this change is going to impact large facilities more so than maybe smaller or medium-sized facilities. who's
And this
50%
person-
capacity, or, you know, they would never get near 50 people max anyway. So it's going to help the larger facilities or impact more than it will the smaller ones.
And this person clarified that it was in 64 individual businesses, but if the capacity of those individual businesses is not 50, you know, they're gonna have to get to 50% or 50, whichever's lower.
Yeah, shared spaces, and that's one of the things that we're asking for the state to provide the clarity on, because we know it's come up with a lot of the salon types folks before, where there's suites where they're all different owners, and they've been having to, so that's sort of an individualized or kind of a nuanced situation where the shared spaces, like the entryways, the exits, the restrooms, you have to work as a group then of 64 individual business owners to make sure that you don't have people coming in and out that are, you know, not able to maintain social distancing. You have to figure out who's responsible for the bathrooms, who's responsible for this and that. But an individual business can use and stay at that 10 person, right now, that 10 person max in their individual business. But they have to work with everyone else on those shared spaces.
People have come to me and said, oh, we didn't even think about the bathroom, or, you know, we didn't think about that hallway to get to all of it. We needed to stagger our appointments so that we didn't have large numbers in the hallway. So that's
why everyone is required by now to make appointments. It's not a walk-in situation for anyone yet, for that exact reason, is that it would be impossible for businesses to control social distancing if it wasn't by appointment only. So if you're in a shared space, you have to kind of figure that out collectively. And just as a reminder for bathrooms, best practices is you need to make sure that when people are using the restroom, they're socially distanced in the restroom. So you might need to cut off or close certain stalls, or, you know, close off a certain sink or two. So when people are in there, they're able to still stay 6 feet apart, and make sure those are cleaned on a more frequent basis than maybe they were before. So shared spaces has a lot of things to consider that's above and beyond maybe the specific personal services, what you can do in your own space.
All right, Jesse, I have a question for you, and it will tie to all the other industries, but is it okay to see a client for massage or acupuncture who believes they had the virus in mid-March, so a presumed positive, had a negative antibody test, and have recovered and currently have no symptoms? So we're talking mid-March, talking 2.5 months.
You know, the antibody tests are hit or miss at best still, but I think the guidance I would give you is, as long as you are following all the precautions, masks for both of you, cleaning, gloves if you can wear them, if your profession allows, and you do a full health screening for the employees and for the patients in the case of limited healthcare, you can provide services. The precautions are really to try to avoid active cases being treated. And so whether it was mid-March or 14 days ago, and they say, oh, I felt bad 14 days ago, that's something to record, that's something to be aware of. But if they are not exhibiting symptoms right now, you can provide those services.
I think, Jesse, that's the key point, is they need to have self-quarantined and not been exhibiting symptoms for 14 days. So that's what you would want to ask before booking the appointment.
Right.
And if they have been symptom-free and then they come in and you symptom check them and they're still not exhibiting symptoms, it would be fine to perform services.
Yeah. Thanks
And
for that. Yeah.
one clarification on the symptom check. So on the thermometer, the fever check, it's, you know, if you ask a person, have you had a fever, without any ibuprofen or Tylenol to reduce that fever. So if they say, I haven't had a fever, but I've been taking ibuprofen,
Right.
that's different. It's no fever without any aid to bring that fever down.
Exactly.
Absolutely.
Yeah. And so as a provider, you can always suggest, let's just push this out another week or two if you're comfortable, and just give them a little more time. But as long as they self-quarantine and, like you said, aren't exhibiting symptoms for 14 days without any sort of assistance from another product, then they should be fine to perform services on.
Yeah.
Okay. All right. Do I have any more questions out there? So we know that there's some uncertainties. We know that there's some changes that will be happening on Thursday. This is why we have these calls. So when they come out, and we're gonna send out the information as soon as we have it. If we get that information and we send it out to you, still have questions, please ask those questions. You see the email address up on the screen. I know Cammie and Jesse both feel this way. We want our businesses to open in a safe manner. We want people walking in to know that you're practicing in a safe capacity, you're following all the rules. We want your employees. We've gotten a lot of comments from employees who've said, how do I know my employer or my owner is doing something in a safe way? And so being transparent that you're following these checklists and that you're doing this, these safety protocols are very important to maintain that confidence factor. And I do have a few more questions that came out while I was doing that.
And I'll just reinforce to anyone who's a staff member versus an owner or a manager, those checklists we made public for that exact reason too, is that we didn't want just the owners and management to know what all the guidelines were. We wanted them easily accessible for anybody, so then you would know what the guidelines were or recommendations or requirements were, regardless of whether your leadership provided it to you or not. We're encouraging all leadership to provide it with their staff and or even with their customers so everyone can be on that same page. But we also know that's not always happening. It's not necessarily a malicious thing. It just might be an oversight, but that's where we want to encourage everyone to review those checklists so they can be aware for themselves. What are their employers supposed to do? What am I supposed to do, an employee? And what are we supposed to be doing for customers? And that's why we make it public on our website, so then everybody can see what should be going on and help each other kind of make internal decision-making factors. And that's why we also have then the call center and our complaint form too, that if someone is feeling like an employer is making a mistake and either just needs education or is doing something directly out of compliance, you can call and we will help follow up with that business owner or manager as well. That's what our team is doing too.
And you can also submit if you see someone outside your industry. So we had a bunch of restaurants submit, or people submit anonymously about an anonymous restaurant or a restaurant. And it's more important that we get the education out there and that we make sure everybody has the information so that we can all be safe and get our economy up and running.
And our team always starts with education first, then followed by warnings, then followed by more progressive kind of action as it goes. It's not, it can eventually result in an order to close, but it's not happening very often these days. And, we're happy to not have to be doing as many of those as we were at the beginning during stay at home. But that's why the checklists we're hoping are helping make it more obvious where to find the right information, kind of in a one-stop shop.
Okay. So I have a few more questions that came in while we were talking. Are there still restrictions on those who have traveled?
Yeah. Not that I know of. I'm
as far as like just like
I think
locally,
there's
or
domestic and I think there's domestic and foreign travel.
Yeah, that one.
So while you're looking that up, Jesse, I'll ask her. The question's about domestically, by the way. They clarified.
Oh, okay.
Are there any restrictions about, somebody, either an employee or a customer that has traveled domestically? And while you're looking that up, I will ask the question about thermometers.
Mm-hmm.
The infrared thermometers, people have heard that sometimes you need to get to a room, you need to get your body temperature at room temperature.
Yes.
That taking it outside, sometimes you might find that temperature readings are off.
Yes.
What are some guidance on infrared thermometers?
So I think one of the, just about the temperature taking in general, regardless of what thermometer it is, and that might be more what their question is, but some best practices is definitely, especially as the weather gets warmer, our body temperatures, even as we're commuting over to a facility, might go up in our car or because we're bike riding or walking or whatever it might be. So if you build in time for people to potentially cool off before the services start, and that might be one thing, recommend sit in a shady place outside or cool off in your car, whatever it might be, get off your bike. We'll temperature check you in a few minutes, not right off the bat, because it's probably going to be a false high. People can bring their water, drink, just whatever situation might make sense for your customers or clientele. You might want to build in a little bit of that extra space for their body temperature to cool off before taking a temperature reading. If someone is high and they're like, oh no, I'm not sick, it's just because you can always say, let's wait 5 minutes and do it again. It might just throw off the timing of then your services. That's why I'm recommending maybe build in the time in kind of those staggered appointments so you can account for symptom screening needs or delays potentially. You can always have people, wait outside, and if it just gets to the point where you keep getting highs, then you would have to reschedule and not perform the services.
And can you tell us again the temperature reading that is considered a fever?
Yeah, it's 100.4 or higher. So you'd want it to be, well, 100.4 or lower is fine. 100.4 and higher is considered a reschedule, automatic reschedule, and decline the services.
And then I got further clarification on that travel. Apparently it's not about customers that you serve, but is there restriction on traveling yourself, going to the mountains or driving and staying in an Airbnb out of state?
Oh, and so a lot of that personal recreation questions we're going to be addressing in our 4 o'clock session as well. But those are definitely getting more lax, and people can do more of that. And we're going to cover a lot more of that in the 4 o'clock session as it's directly related to recreation.
And in Colorado, short-term rentals have guidance on the state of Colorado website for their reopening, but you should probably check the state in which you're traveling to, because that's the state of Colorado. But let's say you're going to a state that has much more restrictions, you may need to check the state you're going to as well.
And I will say county to county here in Colorado is very different, and because the local public health agencies are the ones who are charged from the state to kind of make local guidance decisions, check the county, plan ahead if you're going outside of Boulder County to see if there are any specific travel restrictions, if there's trailhead restrictions, if there's park restrictions, whatever it is you might be interested. And I know just in general, because we're presenting on it next, a lot of what they're recommending is gas up, grocery up, get your supplies in your own local community so you're not tapping out the community that you don't live in by getting all of those kind of basic needs somewhere else. So they're saying plan ahead and bring all of your own supplies as much as possible so you don't use up resources in a community where you do not live.
Okay. And you're limiting exposure in that community as well, especially if you're going.
Yep, you don't have to go into those stores. You don't have to do all that stuff if you do it at home first.
Okay. So there's a question, are there new symptoms we need to ask regarding skin rashes or vascular problems?
The current CDP or the symptom tracker that's linked to on everything, if there's any updates, it'll be listed there as well as on the sample forms that you can fill out. And all those symptoms, if it's updated, it's all within the symptom tracker information that's kind of provided far and wide. But nothing specifically that we've been alerted to.
Yeah,
I think people hear on the news, oh, this is maybe a new symptom for, and it's big part of that, the news story, and there might be a couple cases in another state.
Totally understandable, yeah.
I just looked at the health screening guidance on the CDPHE website, and I didn't see anything new or specifically related to skin rashes or vascular conditions.
Look at that. We have one person looking, one person talking, one person asking questions. All right, are there any other questions out there? Again, we will be covering fitness and outdoor rec in the next session, just because we had realized that was taking up a big portion of the personal services. So you have any questions about limited healthcare or personal services at this time for Jesse or Cammie? That'd be great. Otherwise, I'll just reiterate, ask your questions. We want you to understand how to safely reopen. We'll get you those resources as they come out, but don't always rely on us. There are those sites that we've given you the links to in the past that you can go and look at the frequently asked questions on the state of Colorado website. There are a lot of resources out there, and we've tried to provide over the last couple of weeks some of the trusted places, the CDC, the CDPHE, DORA, Boulder County, the Chamber. We're trying to keep our stuff up to date as much as possible. If you have a chance, please provide feedback on the draft guidance for personal recreation, outdoor industry, and places of worship. I will send that out with the email, and we hope to see you next week.
Yeah, we'll definitely go over the changes next week instead of just addressing what might happen. We will go into the weeds next week on what actually has happened. And so for some of you, even though I was just going to say, I thought of this earlier, is even though the guidance might be available on the 4th, that doesn't mean you'll be ready to open on the 4th. Most of the time, if you're kind of stepping into this, you're going to need a few days to get things in place. So just know the official guidance you've been waiting for will be available on the 4th. You probably will not be operational on the 4th, or to assume that might be putting yourself in a position where you're over your head. It has generally taken other sectors at least a couple days to prep their spaces, prep their staff, prep their guidance, prep their signage, do all the work that they might need before they actually open. So just as a caution of, even though I know people want to rush to it the day that the guidance becomes available, it's just your first chance to see it. It doesn't mean you'll be ready to operate. If you can, great. We know you want to operate as quickly as possible, but just, that's why we say look at the draft guidance. You could kind of get a sense of what you might be needing to do to prep when the official guidance is out.
And we've learned our lesson the last week with restaurants. Not every restaurant was ready to open last Wednesday because there were a lot of requirements there. And those that opened and weren't following it completely, people called on them. People complained about them.
If they provided the guidance on one day and said you could open a few days, it'd be helpful if there was a bit of a gap, but they're saying you're open on the same day the guidance is available. But I think reality, as we've learned, and that's what we want to share, is just give yourself a little time to open. You'll be in a much better position once that guidance is officially available on Thursday. But we definitely wish you all the very best of luck.
All right, since we have 3 minutes, I have one last question that come in. Have you heard the infrared thermometers are accurate or so, or do they typically run low?
I haven't heard anything specific about it. Cami, have you heard any?
I have heard this. Yeah, I hear a lot of people saying they're false reads. They're not good. They're not. And I think that's part of, I know on our PPE handout, I know that our safety officer for the county has vetted thermometers that he would recommend versus thermometers that they don't recommend. So that is on the PPE handout that's on our Boulder County website.
And in some industries, I've heard they run hot because they were taking the temperature outside. So I think you just look at the guidance, do some research, but again, we don't want thermometers that you stick in people's mouths or any of that stuff. So that's why a lot of people are doing the infrared. Yeah, you're laughing at me, Jesse, but that question has actually come up.
I'm sure it has. Absolutely.
All right, well, we hope to see everybody on next week's call at 3 o'clock on Tuesdays. We'll add retail in, so we'll have a dynamic conversation. But keep asking those questions and we'll see you next week.
Thanks, everyone. Bye.
Thank you.
Thanks, Corinne.